Today is the start of Men's Health Week, and on Sunday we honor all of the dads out there for Father's Day. It's the perfect time to talk about keeping the man in your life healthy.
That's right. Here with some easy-to-follow men's health tips is Dr. Olayinka Alonge with Healthcare Partners Medical Group. Hello, sir. How are you?
Very happy to be here today.
You said a mouthful,
very happy
right?
Men's Health Week is obviously very important, especially because men try to avoid the doctor, don't they?
You know, as men, we have a lot of things going on.
Yeah.
You know, we're out there going to work.
Not as many things as women.
True, true. We're out there going to work every day.
Right, right.
You know, we're taking care of our families. Some of us are walking the dog. You know, and we kind of just procrastinate and don't really take care of ourselves as well as we need to.
Yeah.
And so I was really happy to come here today and talk about how men can actually take care of themselves and do some preventative care so that we can be around for our families and live into our late 70s, 80s, and 90s.
Absolutely.
All right, so let's talk preventative. What are some of the maybe the top 3 things that men need to do, like literally right now?
First thing is get a doctor, please. 1/3 of men
don't have
no
doctors?
doctor.
You're kidding me.
So get a doctor. You know, come in, talk to us. We'll sit down. We'll take a history. At Healthcare Partners, we like to do complete total care. So we want you to come in, we sit down, we talk about your family history, we talk about things that have kind of gone on, we talk about whether or not you're smoking, what your diet is like, whether or not you're eating appropriately, whether or not you're exercising. So we talk about the whole thing. Apart from that, we then do a physical exam. We check your height, we check your weight, we check to see if you're obese or not. And then we talk about some of the things that are, some of the diseases that are prevalent that we need to kind of address.
Yeah, diabetes being one of the big ones.
Yeah. Diabetes.
1 of 4 of the people that have diabetes don't even know they have it.
Absolutely.
Yeah.
So turns out that the main killer for men is heart disease.
Wow.
Okay.
So in heart disease, the main thing you want to know is what your blood pressure is.
Yeah, you want to know your numbers.
You want to know what your cholesterol is. You know, if your blood pressure is high and your cholesterol is high, you have a problem. We can do a lot to prevent you having that heart attack if you kind of come in and kind of get that addressed.
Now, at what age should men start going to the doctor regularly?
You know, I think we should go to the doctor at all ages, to be honest with you. But as you get older, obviously, the more often you should kind of come in. I say, come in once a year. At the very least, once every other or every 3rd year. You know,
just in the news today, Tommy Chong of Cheech and Chong just announced that he has prostate cancer. This is something, the guidelines keep changing.
Yes.
So at what age and how often should men have the PSA test for prostate cancer?
So I'm really glad you brought that up because it is so controversial these days. We used to think that prostate cancer, everybody should get a PSA, everybody should get a digital rectal exam. Let me just say for the men out there, we no longer recommend doing that as much.
Oh, really?
No more rectal exams. I'm a fan of that. That's a good thing.
There was a big sigh of relief over here.
And the main reason is because we found out that once we were doing so much screening, some of the procedures and some of the things that we did afterwards, we weren't sure if it was doing more harm than good. So now my recommendation is go talk to one of my healthcare partners or your own physician. Sit down, talk about your risks, determine if you really do need a PSA, because some people will still need it, and go from there.
Absolutely. And it's just time to stop making excuses as to why you can't go.
Absolutely.
What advice would you give to your patients that do come in? What advice do you give them?
So one of the things we always talk about in general is your overall health. Like I said, we try to be total care. And as far as your overall health goes, it turns out that diet is really important. You are really what you eat. Exercise is really important. It's important for your vigor. It's important for your mental health, so exercising. And then we talk about all the preventative things. So some of the things we haven't talked about so far, colon cancer screening, very important. Okay, if you have a family history of it, in particular, African Americans, we consider getting them a little bit earlier because they have a higher risk of developing colon cancer. But at 50, get a colonoscopy.
That's the age.
Get a colonoscopy. And if you're really scared of a colonoscopy, which I think is the best test, if you're really scared of that, do stool for blood samples. It's a great screening, and it can kind of let us know, give us a good heads up as to what might be going on.
The key is to catch it early so you don't have to go through what's to follow.
Absolutely.
It's never too late.
Absolutely.
That's the key,
right,
too.
Doctor.
So.
It's a pleasure. Thank you so much.
Thank
you so much for having me.
Appreciate it.
All right, Dr. Alonge. Alonge, I said it right again.
Very good.
His office is located on South Rainbow, and you want more information on Healthcare Partners Medical Group, you can call the number or check out the website on your screen. Next on the Morning Blend, our clear image of the day. Whose winning smile is in the running for lunch and possibly free LASIK as well?
Ooh, now remember, meantime, be sure to check out VegasMorningBlend.com. There you can talk back with us, view our contests, and print recipes. Again, it's VegasMorningBlend.com, and we'll be right back.